Now we are going to discuss type B reactions. B stands for bizarre. Bizarre means they are unrelated to known pharmacological actions of a drug. They are not related to the pharmacological actions of a drug. They are highly unpredictable. They are highly unpredictable and they are unrelated to the dose. They are not related to the dose. They are not predictable and they are not related with the pharmacological action of a drug. So, what is the etiology? Etiology is the immunological and pharmacogenetic mechanisms. What is the etiology? Genetic or immunological, and often not discovered until after drug is marketed. Most of the time, these reactions, bizarre type of reactions, came into uh, means recognition only after drug is marketed. When the drug is available in the clinical market, then only these reactions will occur. Both environmental and genetic factors are important. Environmental and genetic reactions or genetic factors are important for this. Now, drug allergy. We have to understand what is the meaning of drug allergy. This is the hapten. This is the hapten and this is the body protein. Whenever we expose to some allergen, whenever we expose to some allergen, this hapten combines with the body protein. Whenever we expose to some any allergen in the form of pollen, grains, dust, air, everything. Whenever we expose to some allergen, what happens? There is a binding of hapten to the body protein and there is a formation of antigen. And this antigen is a stimulus for the antibody that we all know. Okay, this is the first thing that occurs. After, when we next time expose to the same allergen, when we next time expose to the same allergen, what happens? Next time, again that hapten will bind to this body protein and there is a formation of antigen. Okay, but now there is already antigen is there next time. So antigen all binds with the antibody. Antigen binds with the antibody and there is a formation of antigen antibody complex. And whenever this antigen antibody complex is formed, there is a release of chemical mediators from the mast cells, release of histamine from the mast cells, and which is responsible for the allergy, which is responsible for the allergy. Okay, so hypersensitivity reactions, hypersensitivity reactions, these are nothing but the immunological mediated reaction which produces stereotype symptoms which are unrelated to the pharmacological profile of a drug, which is unrelated to the pharmacological profile of a drug. So type 1 reaction is IgE mediated. Type 1 reaction is IgE mediated. Type 2 reaction is cytotoxic, IgG mediated. Type 3 reaction is the immune complex or Arthur's reaction, and type 4 is a delayed or cell immediate type of reaction. We'll discuss these one by one. Type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction. This type 1 hypersensitivity reaction, it occurs within a minute. It occurs immediately after the drug is given and it may last for 2 to 3 hours. Type 1 is a rapid thing that occurs very rapidly. It occurs within a minute and it may last for 2 to 3 hours. Rapidly occurring reaction, hence called immediate type of reaction. For example, it occurs whenever the drugs like penicillin or radio contrast dye is given, or it occurs with the drugs like diclofenac also. It occurs with the other antibiotics like ceftriaxone also. Okay, so it is very common with the drugs like penicillin, ceftriaxone, cephalosporin, diclofenac, radiocontrast dyes. So patient may develop these hypersensitivity reactions and patient may land up into the anaphylactic shock. It's a life-threatening condition which is characterized by bronchospasm, hypotension and angioneurotic edema. It is characterized by bronchospasm. So there is a shortness of breath. Patient becomes sweat, red, urticaria, rash. There is a, if you check the blood pressure, it will become hypotension, 60-90. Angioneurotic edema, there's a development of the swelling of the lips, eyes become red, sweating, patient becomes um, means all red. So all these are the reactions, symptoms that we can see in patient of type 1 hypersensitivity reactions. So it's a life threatening condition and we have to manage it very early and on an immediate basis. So we have to be ready with the 0.5 ml of adrenaline. We have to be ready with the hydrocortisone. We have to be ready with the pheniramine, that is the Avil, and we have to be ready with the intravenous fluid. In some cases, we have to ship the patient to the ICU for next 24-hour monitoring. This is the type 1 hypersensitivity reaction. So what is the mechanism in this? Mechanism in this, when we expose to certain drugs, like penicillin, aspirin, lignocaine, diclofenac, ceftriaxone, there is a production of IgE antibodies. It's IgE antibody mediated. So that IgE will fix to the mast cells. IgE fixed to the mast cells means whenever that allergen, here allergen in the form of drugs, allergen, when it is exposed to the some individual, there is a production of IgE antibodies that will fix to the mast cell. Okay. Next time on re-exposure to the same drug, there is a formation of antigen-antibody reaction on the mast cell surface and release of chemical mediators or inflammatory mediators like histamine, 5-hydroxytryptamine, prostaglandin, leukotrienes, platelet activating factor. All these chemical mediators are released, and that mediators like histamine is responsible for hypotension, bronchospasm, angioneurotic edema, urticaria, rhinitis, anaphylactic shock. Right? So patient develops life-threatening condition and we have to manage it very early, very immediately. Now, type 2 hypersensitivity reaction. This occurs within 3 days of drug administration or within 72 hours of drug administration. It will at least take 72 hours or within 72 hours of drug administration. Here, drug binds to the RBC. If drug binds to the RBC, so they are related to the blood, hemolysis. They are related to the blood and it is recognized by IgG antibody. Type 1 hypersensitivity reaction, it is recognized by IgE antibody. Here it is identified by IgG antibody. The antigen antibody reaction triggers, there is a lysis of RBC. RBC will die by activating complement system. So this type of hypersensitivity reaction occurs when it occurs whenever there is a blood transfusion reaction. Whenever we transfuse the blood, thrombocytopenia, granulocytosis, hemolytic anemia, fever, SLE, after the patient when exposed to the quinidine or cephalosporin. Type 2 hypersensitivity reactions are very common. Okay, blood transfusion reactions are type 2 hypersensitivity reactions. Here, IgG or IgM mediated, the antibody reacts with cell-bound antigens. Antigen reacts with the specific antibody. There is an activation of the complement, destruction of the RBCs, and patient land up into hemolysis. Patient land up into hemolytic anemia. Now type 3. Type 3 is the immune complex mediated or arthrus reaction or serum sickness. Type 3 reaction. It occurs after 72 hours but within 1 to 2 weeks of drug administration. It's a IgG mediated. Again, it's a IgG mediated reaction. Soluble antigen antibody complexes are formed and where it will get deposited on the vascular endothelium and that will activate the complement system. And the drugs here in that category, serum sickness or arthrus reaction in the form of glomerulonephritis, polyarteritis nodosa and Stevens-Johnson syndrome. Very common, very rare, not very common, very rare, but it's a life-threatening Stevens-Johnson syndrome. It's a type 3 hypersensitivity reaction. It occurs after 72 hours but within 1 to 2 weeks of drug administration and it's IgG mediated antibody, and here antigen antibody complexes are formed which are deposited on the vascular endothelium and that will activate your complement system. So please remember this Steven-Johnson syndrome. It's a type 3 hypersensitivity reaction. Okay, uh, that is IgG mediated soluble antigen antibody complex. It will fix the complement, and that complexes will deposited on the vascular endothelium, that will initiate the inflammatory response. Lysosomal enzymes are also released, and that will develop this Steven-Johnson syndrome, serum sickness, rash, polyarthritis nodosa. Okay, so which drug causes the serum sickness? Drugs like penicillin, sulfonamide, that will cause serum sickness. What is the serum sickness? Serum sickness is nothing but the fever, urticaria, joint pain, lymphadenopathy. NSAIDs like diclofenac, it can cause interstitial nephritis. Your kidney will be gone. Interstitial nephritis. Sulfonamides, cephalosporins, penicillins, fluoroquinolones, they can cause this Steven-Johnson syndrome, type 3 hypersensitivity reaction. Now type 4, it's a delayed hypersensitivity reaction. They are mediated by the production of sensitized T cells or T lymphocytes. Antigen, it will activate the sensitized T cells. It will release the cytokines which activate macrophages, granulocytes, natural killer cells that will generate an inflammatory response. So drugs like topical antihistaminics can cause contact dermatitis. Tetracyclines and fluoroquinolones, they are phototoxic drugs, so it can cause phototoxicity. Drugs like sulfonamides and chloroquine, they are photoallergic drugs. Okay, so this is the type 4 hypersensitivity reactions or delayed hypersensitivity reactions.